Let's go back to the slide. And so as you remember that we stopped with, we've just read the abbreviations related to frequency of how frequent we should take the drugs. And now, yes. Now let us listen to somebody commenting on the meanings of the abbreviations which are given here in the route of administration group. Now, Ritik, we can listen, we can hear you. So please, what do these abbreviations stand for?
Yes, ma'am. In route of abbreviations, there are IV, IM, SC, PR, INH, and NEB.
Yes.
IV stand for intravascular, IM stand for intramuscular, intramusculus, SC stand for subcutaneous, and PR stand for
Rectum.
Rectum. Birectum means.
Yes,
Then
INH and NEB.
Yes. So who can help us with the INH?
Inhalation and
Inhalation by
nebulizer.
inhalation.
Nebulizer.
By nebulizer.
Yes,
NEB is by
and-
nebulizer.
And
By the
IV,
mouth.
IV, will you repeat what?
Intravascular. Intravascular.
Intravascular.
Intravenous, yes? IV.
Intravenous.
Yes, ma'am, intravenous.
Okay.
Intravenous.
Now, about measurements. Sayonika, is she here?
Yes,
Yes,
ma'am.
ma'am.
Yes, please, Sayonika, about measurements. What do these abbreviations?
Microgram
આપણે જ ભોગવાનું અમારી યુનિવર્સિટી આવી જ છે.
and
Microgram.
શું છે?
Yes, sorry.
milligram and milliliter.
Milliliter, exactly. Okay. Well, good. We are very good at just reading the recipes. And now there's one more exercise on the same topic connected with abbreviations. We should say what is written in the chart. We should say it in full sentences. As you see in the chart, we can see the column about the name of the drug: paracetamol, loperamide, ranitidine, atorvastatin. Then there is information about the dose. Then the next column is how frequent it should be taken. Then the route of administration, and maximum dose per day is in the last column. And there is an example given below the chart about the paracetamol. You can see it should be like, give the patient 1 gram of paracetamol 4 times a day by mouth, up to a maximum of 4 grams. So please, you can use give the patient, give between, and give up to a maximum of. Please write similar sentences, full sentences about the other 3 drugs which are presented here in the chart. Now, 3 minutes for you to write it individually. Start, please.
One step. Four milligram. Mm-hmm. 16. BD.
Okay, let us check what we've done. And now, Muhammad, please, about
Yes, ma'am. Ma'am, the first sentence, ma'am, the first drug is like paracetamol. So it will give like 1 gram of paracetamol. QDS stand for ma'am 4 times a day. So the whole sentence is like 1 gram of paracetamol 4 times a day, and PO stand for orally, like taking orally by mouth up to maximum 4 grams.
So yes,
And
the
ma'am,
sentence is given just above
yeah,
the below the chart. Yeah.
ma'am, now second sentence is like 4 gram of loperamide, 4 gram of loperamide as required by orally up to 16 milligram. Once a day or maximum 20 days, 4 days. And the third sentence is ma'am like 150 milligram of ranitidine twice a day by mouth up to 30 milligram a day.
300.
And ma'am,
300
the fourth sentence is ma'am 10 to 80 milligram of atorvastatin once a day by mouth up to maximum 80 milligram.
Okay, thank you. Yes,
Yes,
well
ma'am.
done. So this is the
Thank you,
way
ma'am.
that the doctor should explain the patient how much and how often to take the drugs. Well, and here is an example of a drug chart which is used in a hospital in the wards. Mishra is coming. Yes. And so let us have a look at the gaps which we can see in this drug chart. You see that first there is the name of the patient is given here. Her name is Mrs. T. Hawthorne. Then there is DOB. What do these letters stand for? DOB.
Date of
Ma'am,
birth.
date of birth.
Exactly. So then hospital.
Date of birth.
Yes. Then there is a gap. The heading is drug. What should we write here?
Drug
Ma'am, the
name.
drug name.
Drug name.
Name of the
Which
drug.
we
Yes.
prescribe to that patient.
Date. What should we write? Date
And
here.
the date of
Of
yeah.
the
Date of the
prescription.
prescription.
The date of when the drug is
Prescription.
taken.
Administration.
Maybe prescription, maybe when the drug should be taken. Then route.
How it
Ma'am,
should.
we should like by orally.
Medication
Oh,
route.
yes.
Medication route.
Yes. Then dose we know. Start and time.
When this dose start,
First
Here when
dose.
the
which
first
time
dose
does it
taken by that
take?
patient.
Like
Yes.
4 times a day or twice a day.
Okay, maybe possible. Max frequency.
The number of
Maximum
times this
Now
tablet
here
gram
is
of
the number of times.
Yes.
Maximum time.
The minimum, yes, interval. Okay. then it's clear indications for use, I think.
When we use as required, ma'am, these drugs are given
I
particular
see.
indication.
Okay,
Like twice a day.
yes,
All
and the route
twice
is
a day, like.
also the same as number 3, I think. Yes, we
Yes,
have
ma'am.
route
Yes,
number
ma'am.
3, it's route 8. And there is a
Yes.
signature of a
Given by.
person and given by. What should you write here?
Doctor.
Ma'am, our name.
Ma'am, the doctor.
Yes, the
Doctor's
person,
name.
the person
Prescribed.
who just gives the
Prescribes the
medicine to a patient. Mhm. Now we are going to listen to a doctor who is checking the chart with a colleague, and we should complete the missing information in the chart. So now I'm going to switch it on and you'll tell me if you're here or not.
Unit 5, Listening 1.
Can you
Yes,
hear?
ma'am.
Okay.
Yes,
now.
ma'am.
Mhm.
Unit 5, Listening 1.
Let's see now. Mrs. T. Hawthorne, date of birth 4th February 1963, hospital number 1834572Z. She was prescribed tramadol today, 15th October 2009, given intramuscularly 50 milligrams, started on 13th October at 11:30. All okay. Maximum frequency every 4 hours, maximum dose 600 milligrams. Okay. To be administered as required intramuscularly and given by Senior Nurse Bond.
Do we need to listen for the second time?
Yes, ma'am, the last.
Unit 5, Listening 1.
Let's see now. Mrs. T. Hawthorne, date of birth 4th February 1963, hospital number 1834572Z. She was prescribed tramadol today, 15th October 2009, given intramuscularly 50 milligrams, started on 13th October at 11:30. All okay. Maximum frequency every 4 hours, maximum dose 600 milligrams. Okay. To be administered as required intramuscularly and given by Senior Nurse Bond.
So she has omitted some information which is given here.
She missed it, ma'am.
What did she miss?
Ma'am, indication for use.
No, she didn't.
No, she didn't.
No, no.
No.
Okay, so what is the drug name? Number 1.
Tramadol, ma'am.
Tramadol.
Ma'am, tramadol.
Tramadol.
Tramadol. Date
15 October 2009.
2009. Yes. And route of administration number 3.
Intramuscular.
Intramuscular.
Yes.
IM.
Okay. Start.
11:30.
13th of
13
October.
October.
13th October.
11:30.
11:30. Yes. Mhm.
11:30.
Maximum frequency.
Ma'am, every
4
4
hours.
hours.
Every 4
Every
hours.
4
Every
hours.
4 hours.
Okay. Then indications for use.
Ma'am, as required.
As required.
As required, she says. And route is the
Intramuscularly.
same.
Intramuscular.
Intramuscular.
And the last just gap here given by
Ma'am,
whom?
given by
Nurse
Senior
Bond.
Nurse Bond.
Senior Nurse Bond.
Yes. Senior nurse, just Bond. Her name is Bond, or his name. I don't know. Okay. Well, good. This is a very typical, just a way of just giving information about drugs to prescribe, what drugs are prescribed to a patient in hospital. So, and
Unit 5,
now we are going to read about a nurse. So her picture is here. Her name is Joyce Kame, and she's speaking about her job in the hospital, about her responsibilities. Now we are going to read this article. Just it's divided into several parts, and each part is given on the slide. And so let us listen to Aman. Start, please.
I work as a nurse practitioner at the New York City Hospital. I am a registered nurse who has completed specific advanced nursing education. I have a master's in the cardiovascular medicine and training in the diagnosis and management of the common medical conditions in this specialty.
Mhm. So this is information about her education and the place where she works. Mhm. Okay. So the next piece of information is for Peksha. Please read it.
Yes, ma'am. I provide much of the same basic non-emergency care provided by physicians, generally on the types seen in their specific practice areas like family practice offices, urgent care centers, and rural health clinics, and maintain collaborative working relationships with physicians. As an NP, I am licensed by the state in which I practice through the NCC, National Certification Corporation for Specialty Practice. Rather than a generic focus of education, as a nurse practitioner, I am able to specialize in an area of study I desire and provide care within the scope of my expertise.
Mhm. Okay, about her responsibilities also. Mhm. So NP stands for what?
Nurse practitioner.
Yes.
Nurse practitioner.
Okay.
Non-practitioner.
So the next is for Misha, please.
Yes, ma'am. I may treat both acute and chronic conditions as well as prescribe medicines and therapies for the patient at hand. The core philosophy of the field is individualized care. The nurse practitioners focus on patient condition as well as the effects of the illness on the lives of the patient and their families, informing patients about their healthcare and encouraging them to participate in the decisions are central to the care provided by the nurse practitioners.
Mhm. So this is about core philosophy. Mhm. Okay. And about concordance, let us listen to Nivas. Nivas, no, he is absent. Vandana, are you here?
Yes, ma'am.
So please read it.
Yeah, ma'am. A major concern for myself and other medical practitioners at all levels is concordance. Once a drug has been prescribed, concordance involves the process of prescribing and medicine taking. It is a kind of partnership. It is not just a matter of explaining the benefits of prescribed drugs and the side effects, which can improving concordance is about involving the patient in making decisions about the treatment. Concordance is a process whereby the doctor and the patient cooperate in the prescribing process to maximize the taking of medication.
So as you see, concordance is a kind of agreement between a doctor and his patient. Okay, now I think everything is clear here, and we have several questions here to discuss. And let us listen to just Priyesh about the first question. Read it, please.
Ma'am, the question is concordance a cause for concern for nurse, Kane, and her fellow NPs? Yes, ma'am, it is a concern for her.
So yeah, they are also responsible for concordance.
Should I explain further, or yes or no, ma'am? I can even explain that what is the concern, ma'am. Her concern is they have to actually convince a patient for the particular maximization of drug and keeping the pros and cons, what are the side effects and how it will work. So it is somewhat it depends upon the patient doctor relationship, and that's why maintaining it on a healthy basis is important. That is why it is a cause of concern for nurse, Crane, and her fellow NPs.
Okay, thank you so much. Okay, well, the next is just Ujjwal. Are you here?
Yes, ma'am. Yes, ma'am.
Question, please.
What type of conditions can she treat? And the answer is she treat both acute and chronic conditions as well as the prescribed medicines and therapies.
Okay, good. So then, Sayonika, are you here? No. Rohit? Rohit? Hello, Rohit? Rohit is absent. Ritik, please. Ritik, is everything okay with your microphone?
Yes, ma'am.
So please answer the third question.
What does she consider the central philosophy of working as a nurse practitioner?
Yes.
Yes, ma'am. He is licensed by the NCC, and which can for specialty practice for education, and it is been specialized in doing these kinds of work.
And what does the article say about the central philosophy of working?
Yes, ma'am. I do not.
Who can help us?
Listen.
What is the main idea of providing help?
Ma'am, concordance.
Individual care.
Yes, you're right.
He can provide individual care also.
Yes, you're right. Okay. Thank you. So the next question for Mohammed, sorry. Yes.
Yes, ma'am. Why does she feel her patients need to involve in the treatment decision? Ma'am, because ma'am, she feel like if the patient's taking medicine in time, so ma'am, it will help to ma'am treat diseases like ma'am earlier, like it will help patients.
Okay.
Or like ma'am, concordance is also the factor.
Yes,
Ma'am,
this is
where
concordance.
both can ma'am coordinate and take medicine at time, so it will also help to improve the health.
Okay. So then let's listen to Aman. The next question.
Yes, ma'am. What is specific postgraduate training has she undergone? She has undergone with the nurse, like post graduation in the nursing, so that she could treat a variety of patients in a particular field of that, and so that
she also has a master degree,
nurse,
right?
In the practicing in the cardiovascular practicing
and training.
So you see here. Okay. So, and the next question is for Apeksha. Apeksha?
Yes, ma'am. Yes, ma'am. How does her work compare her with that of the physicians? Just a minute. How does her work compare her from the physicians? It provides the same basic non-emergency care that is provided by the physicians, and generally of the type seen in their specific practice areas like the family practice offices, urgent care centers, and rural health clinics. And it maintains a working relationships with the physicians.
Okay, good. The question is, who do you think should have the right to prescribe medicine? Because she was speaking about that she could also prescribe some medicine in hand. So should nurses and other people be allowed to prescribe medicine? What do you think, Misha?
Yes, ma'am. I think, yes, the nurses should have the right to prescribe the medicine, because they have studied and they are experienced that much that they can prescribe the medicine to the patients. In the absence of the doctors, when there is an emergency, the nurses have the right to prescribe the medicine and to treat the patient. That's why.
Does everyone agree with this opinion?
No, ma'am.
No, ma'am.
So who says no?
Ma'am.
So yes, Priyesh, what do you think?
Ma'am, according to me, I mean, nurses shouldn't be actually allowed to give medication, as prescribe medication until a certain level, first of all, because they aren't trained in medicine. They are trained in the practical ways. Nurses are trained in medicine ways, so they shouldn't be allowed to prescribe medicine. Once a particularly worked for a certain period of time with a doctor, and she is known how this medication works, she can be allowed to prescribe medicine, that too on a very urgent level, which this is how law in our government, in our country also goes. They have to complete a certain tenure of 7 years. After that, they are, allowed to take charge, and they are given as head nurse and head. They are given these
Senior nurse.
senior nurse. They are allowed to prescribe medication, but that too up to a certain level. There are level of drugs in our system, and they aren't allowed to give all drugs. Only a certain level of drugs which are bound to them can be given.
Ma'am, also as Priyesh said,
Yes.
it is under the supervision of a doctor.
Yes, ma'am.
It is a supervision, and if there will be any sort of risk, then it would be on to that doctor, because it is under his supervision.
She
So
should
the
check,
nurse can only
it.
help.
I see. Okay.
Ma'am,
So
this prescription should be in emergency cases, whenever
Emergency.
doctor is not present in hospitals. So then.
Okay, what about other people who should also have the right to prescribe medicine? For example, if we speak, if you go to a pharmacy, can a pharmacist, should a pharmacist be allowed to prescribe medicine?
No, ma'am.
No, ma'am. No,
We
ma'am.
shouldn't.
For
Because
example,
if the pharmacist is given the right to do that, then there is like the person gets addicted to that drug, and the pharmacist will assume it as a disease and give it to the person. This may lead to misuse of the drugs.
And for example, you have a headache or toothache, and
chances the patient.
So
because the pharmacist will give according to him, there might be some other reason. Not only physicians or doctors can know.
So maybe pharmacists can not prescribe, but give some expert advice to a patient to which medicine to take. Okay. And the question is, do you have nurse practitioners or nurses with similar roles in your country? No?
No, ma'am.
Yes, ma'am.
Ma'am, but in emergency cases,
we do have.
the nurse can give medicine or prescription.
We do have.
Yes.
Only in emergency cases.
Ma'am, they are mostly found in
Ma'am, and only the
maternity
senior
wards
nurse
and
can do
wards and
this.
nursing area, ma'am. Maternity wards.
Senior nurses are given
Senior
the
nurses.
yes.
Senior nurses. Okay.
And in case of emergency, they even take the charge on the place of doctor during a delivery. That was the role I was talking about.
I see. Okay, good. Now, let us move to the discussion of benefits and side effects of some medications. So here we're going to speak about aspirin. And so the doctor explains the benefits and side effects of aspirin to a patient, Mr. Johnson. And Mr. Johnson is being discharged from a hospital after an uncomplicated MI. MI here stands for myocardial infarction, which is the same as heart attack. And yes, and discharge means to tell a patient that he or she can leave a hospital. Now, before we listen to this information, let us just look at the sentences here. And in your own words, we should complete the blank spaces in the doctor's sentences. In your own words, please try to do it on your own. For example, the first sentence he is given, I've got some good news for you. The doctor says, you've made, and we are going to.
Good progress.
And we are going to.
Home. Go home.
Discharge you.
Discharge you.
Okay. So what is missing in the second sentence? Let's listen to Priyesh.
Ma'am, first I'd just like to have a brief chat with you.
About what?
About the medical condition.
Okay.
I mean, this
possible
side effect,
yeah.
benefit of the yes, ma'am.
Yes. So Vandana, what do you think of sentence number 3? Vandana? No.
I'm sorry.
3, please.
Am I audible? If at any time you want to stop me and ask questions, I'm taking at one time. Okay. If at any time you want to stop me and ask questions, you can.
You can do this. Okay,
Yes,
good.
there's a lot of information to take.
Number 4, please, Ujjwal.
We are going to give you a very small dose of 75 mg. It's a much more smaller dose than you would normally buy over the counter. You take it orally for twice a day or once a day.
Good. So he's speaking about the dosage and frequency. Now, number 5 is for Sayonika. Are you here?
Yes, ma'am.
Please.
The aspirin will help you a lot as it will reduce your pain and so on.
You'll feel better.
And
maybe.
and so on.
Okay, so he's speaking about how this medicine can help the patient. Okay, so number 6 is for Rohit. Are you here? Rohit? No. So Ritik, please.
Yes, ma'am.
Number 6.
The aspirin, 6th.
Yes.
6th, ma'am.
Yes.
And I will emphasize the word possible, but I just have to point them out. But there is several complications. But I just have to point them out. He can have several complications regarding the doses, or we can say medications.
Okay. Yes. And now Mohammed, the last one, number 7.
Yes, ma'am. Ma'am, sometimes people get naproxen. Ma'am, it is a drug similar to aspirin. So, ma'am, sometimes people get naproxen or aspirin, and can make their case more complicated, or sometimes it can cause to some more complications.
So here the doctor speaks about serious complications and side effects.
And the similar medicines or drugs to aspirin.
And so here we now we are going to listen to the doctor and complete the gaps with the exact words which were said by the doctor. Now let's start.
Listening 2.
Good afternoon, Mr. Johnson. My name is Dr. Howard. How are you today?
I'm fine, Doctor.
That's good. Well, I've got some good news for you. You've made very good progress and we're going to let you go home.
Really?
Yes. But before you go, there's just 1 or 2 things to do. I can see you're very pleased about going home.
Well, I am.
Well, we won't keep you long then. First, I'd just like to have a brief chat with you about your medication.
Okay.
We're going to give you lots of tablets to take with you and make you rattle a bit.
Okay. I thought that might happen.
Right. Now, if at any time you want to stop me and ask questions, feel free to do so. There's a lot of information to take in at one time.
Yeah, fine.
The first tablet, which I'm sure you're familiar with, is this little white one, aspirin.
Yeah.
We're going to give you a very small dose of 75 milligrams. It's a much smaller dose than you'd normally buy over the counter. You take it by mouth once a day after a meal from now on.
Okay. Why do I need to take it?
The aspirin will help you a lot as it thins the blood and so helps to prevent further attacks.
Okay, that's good.
Now, as with everything we take, there are some possible side effects. And I emphasize the word possible, as you may not get any of them. But I just have to point them out so that you're aware of them and can do something about it if anything happens.
Okay.
Sometimes people get an upset stomach, or aspirin can make the stools of some people dark and smelly, or it can cause bleeding, like nosebleeds, or shortness of breath. But remember, I'm just pointing them out to you so that you're aware of them. Also, look at the leaflet that comes with the tablets. If you do get anything, just get in touch with your GP. Is everything okay so far?
Yeah.
Okay. Would you like to go through everything and explain it to me?
Okay, so what is missing in the in the first sentence? You made
Very good progress.
Very good
and we are going to
progress.
discharge. Good.
going to
Let you
discharge.
go home.
To let you go home, yes. In the second sentence, a brief chat with you about
Your medication.
yes. Number 3. So
Feel
you
free
want
to do so.
Feel free to ask.
feel
Feel free
free
to
to
do
ask.
so.
Okay. Number 4, you take it
By mouth once a day
I
after
mount
every
once a
meal.
day after the meal.
after a meal, yes. Then number 5. So
It
the
thins
aspirin
blood.
will help you as
Yeah.
thins
And
blood,
further-
and so
And
Further
avoids
prevents
further
the
attacks.
attack.
Prevent further
Prevents
attack.
further attacks.
Further side effects.
Further
further
attacks.
further attacks. Okay, yes. Then number
Prevent
6.
further attack.
I
As
emphasize
you may not
Ma'am, as
get,
may not get
as
any.
you
You
may
may
not
not
get any
Not
of
get
them.
any.
get any of them. Okay, and people get what?
Upset
Upset
stomach.
stomach.
Upsets us
Stools
and
get
Smelly
dark
Makes
stool.
and
it
make
dark
it
and
stool and
smelly
bleeding.
Smelly
and
and dark
cause
stool.
bleeding, that is nosebleed.
Bleeding.
Bleeding, nose
Gum
bleeding.
bleeding and
Or
nose bleeding.
it can cause
Sorry,
bleeding.
only nose bleeding.
Yes, nose
Like
bleeding.
yours.
Yes, you're right. And shortness of breath, he says.
Yes, ma'am.
Okay, good. So these are the side effects of aspirin. And so in 10 minutes, we'll meet and we'll continue to with the presentations, with the conditions and tests, with the procedures and tests that you've prepared presentations about. Okay,
Okay, ma'am.
see you in 10 minutes.